Welcome to the Longevity and Hormone Health Podcast. I'm Dr. Fareeha Rizvi. I'm a consultant in diabetes, endocrinology, and obesity medicine, and I am joined by Sandra.
And I am a holistic healer and a midlife coach.
Awesome. So, Sandra, we are going to talk about men and why they become ill in midlife. I know this is a big area of interest of yours, and you work with lots of different clients. So tell me, what do you think if you had a headline for the opening problem of what is going wrong with men in midlife? Tell me what that headline is.
Oh, crikey, I would say not being heard.
Not being heard. Okay.
Mm.
I think that's something that will resonate with a lot of people. So what I think particularly about that, following on from that, is that society gives men a job description
Yes.
that they didn't sign up for.
Yeah.
And a set of rules and expectations and gender roles that they have to follow, which just makes things so difficult for some men, and therefore for some couples, and therefore for some families.
Yeah.
So how do we unpick all of that?
Okay, so some of the things that I've seen, especially in guys with midlife, is the fact that, honorably, they've grown up, to be the provider. So they have, they've met their partner, got married, got a stable job, got the kids in school, university and beyond, bought the house, everything like that. And because they're seen as the man of the house, it's like their emotions are often put to the side. And when they're approaching midlife, chances are that their partner is also, approaching midlife. So it's kind of all about, her mood swings and her this and her that and her that. And he's kind of on the side, sort of like, well, what about me? Because men in midlife can have a drop in their testosterone. They can be burnt out. They can have all sorts of different gut issues and things like that, so we know. And quite often when we're looking at all this sort of meditation and mindfulness and all of these things, it's always focused on the women. It's always sort of geared towards the women. It's very rare that you get these full-on men's kind of like, workshops around mental health, around diet, nutrition, emotional health, emotional resets and things like that. So I think, we kind of naturally just kind of support the woman. I'm not saying that the woman doesn't need supporting, but if you look back about, when the woman's having puberty, but boys go through puberty and they have emotional situations going on, but it's usually about the girl. Pregnancy, it's usually about the mom, and then perimenopause, menopause, it's usually about the woman. But guys are always kind of sort of sat on the outside, to support, and they rightly should support, but we should also look at them.
I think that's so resonant with what I see in clinic every single day. I will see a man coming to see me in my clinic with diabetes, high blood pressure, weight gain, feeling exhausted, and they're rushing around in the middle of their working day, trying to fit in a doctor's appointment, trying to get their medication, trying to quickly do their blood test all in one go, where they haven't actually taken a moment to sit down and take a bird's eye view of what is going on and think about the last 5, 10, 15 years, and then think about the next 5, 10, 15 years. How long can a middle-aged man who's got all of these health problems carry on like that for? I often, like, when I have these patients sat in front of me, I'm thinking about their future, where often they are not. And that is what actually very much concerns me.
Yeah, I mean, so I have spoken with quite a few men who are, turn to alcohol, harming, worst case scenarios as well. There are other situations that may happen, and
Just to cope.
And I do feel, and because I feel also that quite often with the men, it is more avoidant strategies that are given to them, you know, go to the gym, play paddle, splash it in ice,
Yeah.
rather than really kind of finding somewhere to actually sit and talk about it. You know, because women, you know, we'll have our coffee mornings and we'll do all of that, but again, you don't really see that much provision for men, and I think that needs to change, and it needs to change fast. I think that I've seen it where I've been around women when they're partners, and it's like, have you done that? Have you done this? Have you done that? Have you done that? And the way that they're communicating with each other isn't supportive. And then he's just sitting there thinking, I'm just a provider, but I can't take it anymore. What about me? And then you've got work, you know, where boundaries with work and the pressures, you know, because if a man is there and he is the provider for everyone in the home, like say the university fees, the mortgage and everything like that, it's got this massive pressure at work as well. So yeah.
Where is the respite?
Yeah.
Where is the respite? I hope the narrative around this is changing, but I don't see it happening as quickly as it is in the sphere of women's health.
No, it's not. I don't think it is.
No, I don't think it is. And I'm quite happy to acknowledge that, you know, and give it a voice.
Yeah.
Because actually what I find in my clinic is when I ask men, you know, how are you feeling? Do you have time for yourself? They will actually be quite honest.
Yeah.
It's almost as if they're looking for someone to ask so they can talk about it.
Yeah.
It's not, I think we've moved away from that traditional where men would never share their feelings.
Yes.
I think now men hopefully are willing to share their feelings in the right situation.
Yeah. Yeah. I think that they need to feel safe enough to be able to share, you know, and that they're not going to be seen as weak because they're sharing their emotions and they're sharing what they're going through. And I do feel, I do feel hopeful that that is going to happen
You
a bit
mentioned
more.
about 2 brothers that you worked with.
Yeah, so basically, the two guys. So one of them was, they both got high pressure jobs. One of them kind of is, you know, sits and drinks alcohol all the time. He's got a bit of a belly. And I was at a barbecue and they was having a conversation. The other one's quite ripped and he's quite positive and all of this. Looked a lot younger than, there wasn't much age. Oh no, they were nearly enough the same age, but about 2 years difference. But the other one just looked about 10 years younger than the other one. And they were having this discussion and they were like, yeah, you know, I'm just tired all the time and I can't sleep very well, this, that and the other. And the other one goes, yeah, well, I was like you a year ago. But then I started taking testosterone and I think he's taking some peptides as well.
Okay.
And he was like, oh, but isn't that for like, you know, if you just, and then the conversation, it was quite interesting because I was sitting there like, but yeah, so he was taking the testosterone and that made him feel better. His mood, his energy, got his strength back and everything. But I mean, I'd like to ask you, like your thoughts, because you know, there is a lot of caution around the use of testosterone.
Yeah. I prescribe testosterone in very specific circumstances. So for a man in midlife who has completed his family and maybe has other medical issues as well that need close monitoring, diabetes, blood pressure, if they are really suffering with motivation, fatigue, maybe weight issues, then testosterone is a reasonable consideration after all the risks and benefits have been discussed. So I had a patient like this yesterday, actually. I saw him with his wife. He's 57. He's had type 2 diabetes for 20 years. His blood sugar is not that high, but it's higher than it should be. He's gaining weight around his tummy. He's an engineer, but he has a company and employs 20 people. So he's constantly got the payroll running in his mind for all of the people that are dependent upon him, apart from his family. And I asked him, have you had a physical relationship with your wife? And they said no, the wife and husband were both there in the consultation. So I used that opportunity to ask them. And they haven't had a physical relationship for 2 years, and he has erectile dysfunction.
Right.
So for that sort of person, testosterone could be a reasonable treatment after he's had the testosterone blood tests, we've improved his blood sugar, we've maybe done some scans, so a prostate scan to make sure there's no prostate cancer. He might need to see a urologist, have some prostate cancer screening tests first. And as long as his prostate is okay, there's no cancer, his heart disease and blood pressure and diabetes are all well managed, and he doesn't want to have more children, that's very important, because I'll come on to another case.
Yes.
He doesn't want to have any further children. For that type of person, a small dose of testosterone, if his testosterone is low, just to bring it up into the normal range, could be very beneficial. With testosterone treatment, we are just trying to get the testosterone back up into the normal range. We're never trying to give
Any
too
more
much.
than
So that's one thing. The other case that I have that I just mentioned to you is a chap in his mid-40s who had a normal testosterone but wanted to get a little bit more ripped in the gym. He'd been going to the gym for a couple of years.
He was taking it for...
He started to use testosterone without ever checking his testosterone levels, which were probably normal. He probably had totally normal testosterone. He started to use testosterone injections at 4 or 5 times the dose that I would give to a deficient person. So, for example, for a testosterone deficient man, I might give 1 injection of a particular type of testosterone once a month. This person with a normal testosterone was using that monthly dose every week. And he came to see me because his wife and he were planning IVF. His wife had her egg harvesting the following week, and his semen analysis that was done to check for sperm before making embryos with these eggs in the lab, his semen analysis showed no sperm because he had been using testosterone or misusing testosterone, which can make men infertile. So now it's my job to somehow restart his semen or his sperm production
again,
in time for this IVF to be able to work. And anyone that's been through IVF or fertility treatments knows that everything is running on a clock.
Yes, yeah.
So that would be my warning message for men. I'm not, discouraging testosterone treatment where needed, but it is something that requires a big holistic approach, lots of tests, lots of counseling, lots of different specialist input. And then even when you start the testosterone as a man from your doctor, you still need a lot of coaching and a lot of lifestyle change that goes along with that.
Yeah. Can I just ask you, I know we're talking about men right now, but whilst we're on the subject of testosterone, because I'm in this group, and I think I mentioned it before, women are passing estrogen around like it's hand cream.
Yes.
But I've also had women in the group asking about testosterone.
Yep.
And I think that this is the dermal one.
Yes.
So can you explain to me, because it's not really prescribed heavily in this region, only I think I've seen it in bioidentical situations. But can you explain from a clinician perspective what the impact of testosterone and how it should be monitored in women who are taking other forms of HRT?
So that's a really good question, something I get asked a lot as well. So our bodies as women make androgens.
Yeah.
There's multiple androgen hormones. These are hormones that both men and women make, but when women make less, men make more. So an example of an androgen hormone is testosterone.
Right.
Women make lots of androgen hormones. These come from our ovaries and our adrenal glands.
Yeah.
So when we are going through perimenopause or menopause, our ovaries don't make those hormones anymore, but our adrenal glands do still make some of those hormones.
Yeah.
What shifts is the balance, actually. So we're just making less of these less of these androgens from our adrenal gland. So there's lots of international guidelines around testosterone replacement in women. The guidelines all say that women should start with conventional estrogen and progesterone treatment as per the protocols. And if there is no improvement in mood, libido, motivation, then testosterone can be considered after 6 months. So that's the general framework that all clinicians that prescribe HRT in women work off of. That's the general framework, because each woman is different. Some women, I had a woman literally 2 weeks ago, she's on HRT with estrogen and progesterone, and she has a very high sex drive, actually. So for her, libido and focus is not so much of a problem. Her symptoms are more hot flushes and weight gain. So for that woman, testosterone is actually not needed. And it actually may make her libido actually a bit difficult to manage, in fact. So that's the other thing. So that's the other thing.
Rampant rabbit.
So that's something that we have to also take into account. And that's the only way you can arrive at those conclusions is by taking a really detailed, honest history about what is happening in that woman's life. So I would say a lot of women would benefit from testosterone as well during HRT with estrogen and progesterone, but we very rarely prescribe it right at the beginning. It's usually after seeing how a woman is feeling and responding to the estrogen and progesterone first. Because the other thing is, you have to remember, when you prescribe a load of hormones together, and if someone gets side effects,
you've got to work out
which one it is. And that's very difficult. And when we give testosterone, estrogen or progesterone in women, we will have certain blood tests that we do after a few months, again, to try and get the hormones into the normal range. We never want to give too much and never want to give too little. So it's an individualized discussion, but I have plenty of women that are on testosterone as well during HRT.
And so how many times do you think that someone should be coming back to you to be tested? Because we've talked before about our hormone tests sometimes are not always great or accurate, depending on where someone is in their cycles and all that kind of stuff. But how often do you think, if somebody is taking any form of HRT, any of the three that you just mentioned, how often should they get their bloods checked?
Every 3 to 6 months.
Every 3 to 6 months.
I would say. Particularly for men. So testosterone is a little bit different in men. The testosterone blood test has to be done at 9 a.m. fasting.
Right, okay.
That's very important. And I'll give you another example of a man that I saw last week. He's trying to conceive with his wife, and his urologist got him to do a testosterone blood test at 9 o'clock in the evening, just before the lab shut. And so he was rushing to do the testosterone blood test, and it was low. And so then he was referred to me, and the question was, is he not being able to conceive because his testosterone is low, and maybe that means his sperm count is low? But actually, I got him to repeat the blood test fasting in the morning, and his testosterone was totally normal, and he had checked his result before he came to see me, and he bought me a box of chocolates as a thank you, to say, actually, I was so worried. His testosterone is normal. That's one thing that's been checked off of the checklist in fertility. And he doesn't need testosterone hormones. Maybe he and his wife need to look at, some fertility treatment that addresses the whole picture. So that was one really important take-home message for anyone that's listening. If you're a man and you want your testosterone blood test checked, have it done fasting in the morning. And, maybe at the same time have your blood sugar and cholesterol and all of that checked at the same time, because all of these hormones interact with each other. Blood sugar, insulin, testosterone, all interact with each other. So those are important messages.
I think that these discussions are so key, Fareeha, because, what I find, especially in the holistic space, is that everyone seems to think that they are knowledgeable about these things. And it's like, even though the symptoms are severe, it seems that people feel that the treatments can just be, I could just borrow that from her. Or she's not taking it anymore, I'll just take it from her. Or, oh, I saw this on the internet, so I'm going to do this. And It's not. It's so
It's not.
important. They're so specific, aren't
Yeah.
they? The sort of like the readings, the testing,
Yep.
the side effects. It's all so
Yeah.
important.
It's
Yeah.
true. I think the problem that has happened, which I will be very honest about, is hormones seem to have just been created for Instagram, right? And I find that very bizarre.
I'm gonna wear a t-shirt.
Everyone is a hormone expert now these
Yes.
days. And people don't realize the nuance that comes with hormones. As you've done your menopause training,
Yeah.
the nuance in hormones is actually the whole basis of hormones. There is very rarely a black and white in hormones. It's
No.
all nuanced.
Yeah.
And I wouldn't expect people, if they were having a heart attack, to be their own cardiologist.
Exactly.
But people seem to think they can be their own hormone specialist
Yeah.
these days.
Yeah.
And that's where people can really run into a lot of issues potentially.
Well, yeah, I mean, it affects.
Yeah.
That's the thing, like with my training, like when I was doing it, I was like, the amount of systems
Yeah.
in the body it affects. And even down to like when I was looking at the bone density and the
Yes.
teeth, and then I was having a discussion with my dentist because I actually had to have around perimenopause time 2 bridges put in, and it was all related.
Yeah, it is.
Like no one tells you that, yeah, by the way, when you go for perimenopause, it could affect the bone density in your teeth.
Yeah.
It just
So we need to get people to understand their bodies and understand the nuance.
yeah.
And understand things like reference ranges and the variation in the general population when it comes to hormones.
Yeah.
There's so many things that
Yeah.
people, even doctors, don't understand about hormones, to be honest.
Yeah.
So how do we spread this message? Hopefully podcasts like this, discussions like this will help the average woman, average man in midlife understand what is happening to their bodies, and then choose the right treatment for them.
Yeah, and I think that so one of the things that I feel is really important is for each individual to take ownership.
Yeah.
I think that is really key, and like we've discussed on previous podcasts, it's about taking ownership, it's about getting second opinions and all of that kind of thing. It's setting the boundaries, because this is your body and it does affect every single woman, and it affects men as well. And like you say, if you had a heart issue, you wouldn't neglect it.
No.
You'd go in for your checkups. You wouldn't listen to somebody else. You wouldn't read an article in a newspaper and think, oh, I'll just do that. Then you'd actually do, you'd follow the protocol for the best future. And I think that's the same with hormones and midlife.
I think that's a really powerful message. So we will maybe discuss other things. I know there's so many other things you want to discuss.
Yeah.
But you mentioned about peptides, GLP-1.
Yeah, I think that that's a whole other conversation. Yeah.
We will discuss those as well. If there's any topics that you want us to discuss, anything you want to share, anything in your own life, any experiences that you've had that, lend itself to our conversation here, make sure you comment, make sure you like and subscribe. I'll put details about Sandra's Instagram and all of the products and services that she offers. I'll put details of my Instagram and my products and services, and we look forward to seeing you again next week.